you. Good job. Okay, ready for some combing? Oh, such a flinch. Such a flinch at first, Your wound is looking so much better. Quite pleased about it. How's your belly feeling? Should I move your snacks closer? I see you looking at them. Ready? I'm going to move closer. Don't be alarmed. Can we try it again? What a good girl. So brave. So brave, so beautiful. I know. Very cute. Very cute. Hi, babies. Your babies are rambunctious. I did consult with Dr. F today. She has checked in on Orinda. Everything looks good. Everything's within normal parameters. We just have to wait. Cats are good at waiting. Better than me. We did have a little bit of belly vision for Orinda today. She's definitely has a more subtle belly vision than like Scotia, but she's eating and doing all the things that we would expect her to do. So we just have to wait. Can't be too much longer. Probably 3 a.m. 3 a.m. on a Sunday is the worst possible time to give birth, so that's probably when she'll do it. 3 a.m. I guess it would be technically be a Monday. Technically, right? You're so pretty. Aren't you pretty? You're so pretty. You should eat your delicious snack. I'm super interested to find out what the vets think about her eye. It's probably not salvageable, but sometimes it looks like maybe she had adhesions and then don't slink too far away. What a good girl. We made short work of that. Good job. You're so pretty. Can you feel your lymph nodes? You kind of have to roll over. You want to do any rolling over for me? Oh, look at this. Such a bowling ball. Such a big belly. Kind of awkward angle, but there, go that way. There we go. There we go. He's so cute. Oh, you definitely feel like you've grown. What about this side? Can I see this side? What a good girl. So brave. So brave. So beautiful. So special. Mm-hmm. What? Hmm? What a pretty girl. What a pretty girl. So talented too. Hmm? Oh, such a good girl. You just want to roll over. I'm glad you're finding your nests comfortable. Isn't that nice? I told you you would like it. And I was right. I'm right about these things. I'm going to just slowly move this. Don't be alarmed. It's alright. Here, let me just get that out of the way a little bit. See? It's alright. Yeah. It's all good. All good in the hood. Oh, there we go. There's a belly. There's a belly coming at me. my goodness, your leg looks amazing. I'm so happy to see that. Can you imagine if you had to give birth and you had to have like kittens crawling through that big old mess? It looks so good. Looks amazing. And your foot is looking better. You're so good at letting me do things to your belly. And look at those big nipples. No milk. Doesn't mean anything. It's so nice to see her looking so much better. She's still quite itchy, of course, but and she still has quite a few nits attached to her hair shafts, but I'm beginning to think they may not hatch, potentially. And maybe they'll just be there till her hair grows out or till she grooms them out. Which is fine. We can allow that. Oh, what an adorable little monster. Oh, there we go. There's your lymph node. I'm very happy about her wound. Very happy. Look how cute she is. Oh, don't get too complacent about the belly rubs. You're so cute. It's hard to remember that you're a feral cat and that this is very new for you, and sudden movements are scary. Node. This one's getting small. It's good. This is looking like so good. So good. And your paw. Can you touch your paw? Oh, that's nice. She was very sensitive about her paw being touched previously. And I can certainly imagine why. Oh, you're so beautiful. You're so beautiful. Are you lifting your leg to give me access? Is that itchy as it heals? You're so beautiful. Oh, look at you. Look at you. Oh, there we go. Look at that belly. I wish I could move that empty bowl out of the way, but I don't know if I can without. Let me try to do this. Here, you come back in. Good job, you did so good. You did so good. Oh, here we go. Look at that. Look at that belly. You're so pretty. You're so pretty. Kittens. Kittens. I'm hoping for small litter. They're pretty rambunctious though. So much better. You're so pretty. What a good girl. What a good girl. I need to sleep. A little more time on this one. I wonder if you let me comb back with my other hand. Not really good at left-handed combing. I just got some scabs and stuff. Oh, she likes it. Probably it's itchy. Not really good at combing with my left hand. That's so good. I bet it's itchy. Everything's itchy, huh? Everything's so good. It would help if it was facing the other way. So I could see what I'm nitpicking. That feels so good. It's like a pedicure. For real. He's such a cute cat. You just have to not forget. Don't forget the good times. Once you're feeling better. Once you have babies. You just have to remember the times that I picked your nits and picked your scabs. And your toe jam. Your crusty toe jam. Can you turn it this way a little bit? I know I'm really pushing your luck, but you seem to be enjoying it. So, keep pushing. This cat is not the usual kind of responses. Most ferals wouldn't let you pick their foot scabs and their belly scabs. They're very special. You know, you're just that itchy. Maybe that will help it. A little bit of little pile. So cute. So cute. And now I feel like I have fluff in my nose. Your crusty foot fluff is in my nose. Thank you for that. That's cool. There's some more crust I picked off of you. I'm so helpful with your scabby fluff bits. But should we come in this part? That's weird. Here there's some scab. I'm just picking all your scabs now. Brushing up your scab fluff. There. Oh, so nice. So nice. This foot is perfect. This one is itchy. It'll look a little pathetic once it's bald. Okay. Oh my goodness, look at its belly. Look at this bubbling ball belly. You can get a good view of your back end too. Oh, such a good belly. Alright. The lice are definitely under control. There may still be a few that are going to hatch and then die, but I'm very pleased with the progress there and with how well she's healed down here. That looks amazing. It's like I was worried it was going to take a long time for that to heal because it was so inflamed and just so oozy and so large. But antibiotics are doing their jobs. She's so much less scabby too. And cleaner. She's been able to groom a lot of her dirty parts. So she's doing very well. She is very proud of her. So if we could just get the Orinda birth underway, I would be grateful. I'm not looking forward to that at all, but I'm less worried about Scotia's birth, but you never know how things will unfold. But hoping Orinda will get to it pretty soon. Look how pretty they are. Still have some. Look, there's still some scabs up here. knit. You probably can't see the knits on that hair. I'll just take that with me. There's still quite a few knits in her hair, but supposedly in 2 weeks they'll all have hatched and be dead. And it's been, what, 10 days? So we're getting pretty close. She was just leaving piles of dead lice everywhere she went, and now there's only like a few falling off here or there. So we're definitely in good shape there. The stuff she's been treated with lasts for 30 days, so although usually with lice we will repeat every 2 weeks. So just to be on the safe side, but she's doing great. So health-wise, I feel much better about her giving birth now than I did when she first arrived. She's a lot cleaner, a lot less bacterial, a lot less infected. We don't want anything feeding on the kittens when they're born, and the kittens would have had no protection from that lice. Lice, fleas, stuff like that can be fatal in tiny kittens because they don't have very much blood supply, and if they're really infested, then they can become anemic and die. So that's not going to happen. That's good. And I talked about the plan for Orinda earlier today, but in case you missed it, because I want to keep her stress as low as possible, I'm not going to take each kitten to be blood typed as it's born. Usually, so to back up a little bit, Orinda, the other cat in this room, has type B blood, which is supposedly a rare blood type, but as we are finding out, is not rare, at least not in our area. And her kittens are at risk for a fatal condition called Neonatal Isoerythrolysis, which is basically when a type B blood mom gives birth to type A blood kittens. She passes anti-A antibodies in her colostrum. So during the first 24 hours when the kittens nurse, they ingest these anti-A antibodies that get absorbed directly into their bloodstream and kill their red blood cells. And so the way we can prevent that from happening is by blood typing each kitten, and anyone that's type B can stay with mom for the first 24 hours, and anyone that is type A needs to be removed for the first 24 hours, and we put them in an incubator and feed them formula and give them serum injections to correct for failure of passive transfer, which is the antibodies that they don't get from nursing, because they're not nursing on the colostrum. We try to replace those as much as possible. And then after 24 hours, it's safe for them to return to mom. But, so in a friendly cat, that's pretty straightforward, not a big deal, not super stressful for the mom. But in a feral cat, it's quite stressful to have the human predator coming in and stealing your babies while you're giving birth. And the tricky part is the timing, because often a mama cat will give birth to the kitten and then the placenta won't come right away. It can be, it can take a couple minutes. Sometimes it can take up to an hour to push the placenta out, and so we need to wait for the kitten and the placenta to come out because we need the cord intact in order to get blood from it to run the test. So I've been frantically trying to look into other ways of getting, we just need like the tiniest amount of blood in order to blood type them. And so I've been trying to figure out ways to potentially get a tiny bit of blood from the kittens without having to have the cord blood, because then that means I can wait, and as long as they're not like getting latched at the milk bar, I can just let her give birth, and that will decrease the risk of stress. I'm so sorry, yarn spinner. So sorry about all my words that I'm talking. So anyway, long rambling short. I have, some advice on what to try. And so I'm going to wait as long as possible. And then ideally, I would love to wait till she's done, but I suspect that depending on how long it takes, the first kittens might make it to the milk bar and start nursing. So at some point, if they look like they're starting to get latched on, or if she's taking a break, like a long break between kittens, then I will probably have to come and steal them midway through. But I'm hoping that we can get at least, a couple kittens out so she's well into the labor process before I have to disrupt her. And then I'm hoping to get, to wait for a kitten with a placenta so I can at least definitely blood type 1. And then I'll attempt on the other ones. And worst case scenario, they will just have to spend the first 24 hours in the incubator, which, if I can't get blood, which is not like the end of the world, it's not the greatest, but at least they won't die. So when you look at it in those terms, it's definitely a better option. And so anyway, that's the plan. So hopefully, can I steal your litter, crumbs? So hopefully we will, can I have this one right in front of your face? Oh, that's very good. So anyway, that's the plan, and that's my anxiety spiral I'm existing in until she gets things underway. So we, and if this works, then it will be a better protocol for the feral moms, because it will be less stressful than having to steal every single kitten. Which is, we hate doing it. I hate doing it because it's, it's disruptive, and they don't understand that you're saving their babies, and it's horrible to have to do. But the alternative is rolling the dice on whether they're going to die. So it's worth it, but it is tough. So luckily, Scotia is type A blood, so I don't have to steal her kittens. So the only reason I will interfere in her birth is if she is having trouble, or if the kittens are having trouble. Then I will intervene. But other than that, I will let her do it. And luckily, I've learned enough about her that I think I could navigate an intervention without causing her a huge amount of stress. I certainly don't think she would react this way if she's giving birth. I think she'll be spicy and feeling protective and all of that, and so I'm not going to push my luck, but I do at least have a good plan and understanding of how best to approach her with minimal stress. So anyway, I am planning to show Orinda's birth live, since she's doing a lot better stress-wise. she's made a lot of progress, and I feel your babies. And so I'm less worried about her having like a Kiwi style of delivery, and because I have an alternate protocol for blood typing the kittens, I think it's going to be better than it otherwise would have been. So I'm going to do it live, and you know, if things get dicey, then we'll switch nests or something and show the Scotia nest. But I think it's going to go as well as it can go, you know, hopefully, but we'll see. What a pretty girl. That's nice. It's nice that we can enjoy our nest time together. And that you ate your meds. Do you want any more of this? I think you basically finished it. And this is petting time, not snack time. Okay, I'm going to turn off this overhead light because we don't need it. And I think our work here is done. This nest is acceptably clean. If you want to, can I have this? Oh, you're stuck. I just will take that fluff out. Yeah, see? We did so good. We did so good. She's very beautiful. She likes belly rubs. She likes the belly rubs. Alright, you can give birth soon too if you want. I'm ready for you. All ready. Okay, now I have to clean up the crusty crusts that I picked out of her foot cloth. But it is looking so much better. Look, she's not even flinching. Well, a little flinch. But so good. You're doing so good. You did so good. Okay. Alright. I'm going to close you back up. And then I'm going to do a little cleanup, and then I'm going to serve dinner. Don't hiss at the door. The door is your friend. And tomorrow we'll have to see about cleaning nests and changing blankets and stuff. But for today,